I think the significance is that the WHO is really marking MS as a public health priority. It is their guidance now officially that every country, everywhere in the world, regardless of their resource level, should have at least some medications available for the treatment of MS in their country.
I think one of the things which I've found most gratifying through all of this process is the extent of solidarity that has been expressed throughout the MS community, patients and professionals. The fact that this has been such a collaborative process gives me hope that for the work that needs to be done over the years ahead, there's an awful lot of great minds that are willing to address the problem.
But in some ways, the hard work now begins because we need to have partners in every country in which these medications are not available, working with their local ministries of health and governments and pharmaceutical bodies to ensure that these medications actually become available. Hi, I'm Deanna Saylor. I'm an associate professor of neurology at the Johns Hopkins University School of Medicine, and I was clinical chair of the MSIF Essential Medicines panel.
My name's Nick Rijke. I work for the MS International Federation based in London. I was a member of the Essential Medicines panel.
And I'm Naomi Smith. You're listening to the ECTRIMS Podcast, the sounding board for the MS research community and the official podcast from the European Committee for Treatment and Research in Multiple Sclerosis. Today, we are doing a follow-up on an earlier podcast which discussed the global application by the MS International Federation and the WHO Collaborating Center Bologna and endorsed by ECTRIMS and 14 other MS organizations worldwide to add MS treatments onto the WHO Essential Medicines List, also known as the EML. Since that podcast aired in April, we bring you some great news. We're very happy to report that MS treatments were successfully added onto the EML in July of 2023. This is an incredibly important step forward in improving access to MS treatments for people worldwide, particularly those in low and middle income countries or low resource settings who face significant barriers to accessing MS treatments. Today, we are once again joined by Nick and Deanna to talk about the impact of this milestone and the next steps for clinicians, researchers, patients, and the MS community at large. Nick and Deanna, welcome back.
Thank you for having us.
Can you start, Deanna, by telling us about the recent development and the significance of the MSIF's successful bid to include MS treatments in the WHO EML?
Sure. As you mentioned, we had submitted an application through MSIF on behalf of multiple global neurology and MS patient organizations to have some disease-modifying therapies for MS included on the WHO's Essential Medicines List. And we found out last month that that application was successful. And so this marks the first time that the WHO has included any treatments for multiple sclerosis on their Essential Medicines List. Our application was to include glatiramer acetate, rituximab, and cladribine on the list, and those three were approved for the list. And so, I think the significance is that the WHO is really marking MS as a public health priority. And it is their guidance now officially that every country, everywhere in the world, regardless of their resource level, should have at least some medications available for the treatment of MS in their country.
Absolutely. And Nick, what motivated the MSIF to take this step, achieving the milestone?
Well, the issue of access to treatment has grown over a period of years, really. In a way, you could say it's a response to science in that the treatment of MS has evolved enormously over the years in terms of what's possible. So there's now a really broad range of therapies notionally available, different mechanisms of action, different modes of administration, different tiers of efficacy with risk as well. But it's clearly the case that from a scientific perspective, MS, at least the inflammatory component of MS, is treatable and it can be well treated. But in many parts of the world, that's just not the reality that they're experiencing. There are, in many countries, there are no treatments available at all still, but even more so, there are people who have intermittent access to therapy, or they have access quite late in the course of MS, whereas of course it should be early, or they have access only to one of the really old therapies. Interferon is quite commonly available, but no access to the more efficacious therapies that people should have access to all over the world. And that's really, it's the gap between what science has made possible and the reality people experience that has made this the issue that it is.
I did not get a chance to say this at the start of the podcast, so I will jump in now. A huge congratulations on this approval. This is absolutely fantastic news. And Deanna, could you perhaps share some insights into the process of putting forth this bid and what it took to get approved?
Sure. Thank you so much, Naomi. I mean, we could not be more excited of the outcome. I will say that the outcome was certainly not predetermined, and there was an immense amount of work and stress and waiting that went into this application. So, I mean, really, this was a multi-year process led by MSIF that, first of all, this application was a reapplication. MSIF had put forth an application a few years ago that was not approved, but was encouraged by the WHO to put forth a new application. And this application really needed to have a stronger evidence base for why we were choosing the medications we were choosing. And so we put together committees that included people with MS, neurologists, pharmacists, economists, different types of MS specialists that reviewed a comprehensive literature search on the efficacy of all DMTs in use around the world, the potential harms, the potential benefits of those. We thought about their use in the context of low and middle income settings, how feasible they were, both from a cost perspective as well as an access perspective and an administration perspective, and really tried to put all of this information together and choose just a few to put forth. And so we know that, we believe that the entire range of DMT should be available to everyone. That's clearly not where we are yet, but just putting forward a few that we thought could meet the needs of a wide range of patients with MS and ensure that everyone has access to some was really the motivation for this. And, a several-year process of really doing this in a rigorous and evidence-based way with input from people and clinicians all over the world that are either affected directly or impacted by MS in some way.
On that note, what were some of the major challenges and obstacles that you faced during the bid process, and how did MSIF overcome them?
Sure. I mean, I think one of the challenges that I briefly alluded to was really just selecting a few disease-modifying therapies to put forward. We knew that the WHO would not list every MS DMT, and so we really needed to think about what were the few that we were going to put forward. And having a globally representative committee working on this project, there were obviously a lot of differing opinions on what those few drugs should be, on what was available, what should be available. And so I think that was one of our biggest obstacles and challenges, was really forming a consensus around which few drugs we were going to put forward. There were also some concerns in the pharmaceutical community, and pharmaceutical companies were not involved in any way in the application development or application submission. And we were very careful to mitigate conflicts of interest amongst panel members as well. And then I think really trying to get MS organizations from very different settings to support our application was a challenge too. Again, because of this concern that somehow in putting forward only a few disease-modifying therapies, we would be limiting access to others in settings where they're currently available. And so we really tried to walk that line in the application, as well as saying that in no way are we saying that only these 3 medications should be available, but rather that at least these 3 medications should be available, and ideally others would be available in the settings where that's possible too.
Right. And can you tell us again which MS DMTs were listed on the 2023 WHO EML?
Sure. So those are glatiramer acetate, cladribine, and rituximab.
Okay. In terms of the impact on MS treatment access, how will the inclusion of MS treatments in the EML enhance accessibility and affordability for individuals living with MS, especially in underserved regions? Deanna, do you want to take this again?
Sure. This is such an important question, and I wish I could sit here today and say that our work is done, and now that these medications are listed, everyone will automatically have access to them. But unfortunately, that's not how this works. And so I think this represents the first step of, again, the WHO endorsing these as necessary and essential medicines in every setting. But in some ways, the hard work now begins because we need to have partners in every country in which these medications are not available, working with their local ministries of health and governments and pharmaceutical bodies to ensure that these medications actually become available. And so we're now working with MSIF as leading these efforts to really train people in advocacy and how to begin that process. I think the official endorsement by the WHO obviously makes that advocacy process easier and more straightforward. It also opens up possibilities of trying to come together and pooling resources to buy medication supplies, maybe at a lower cost if they're bought by multiple countries and a larger supply. And so I think it does open up possibilities for advocacy and improving accessibility. But unfortunately, that's not automatic and is going to take a lot more work to make sure that the potential benefit of this listing is really actualized and results in real changes for people with MS in these underserved regions.
Absolutely. Can you very quickly elaborate on the potential benefits for patients, healthcare systems, and communities as a result of this inclusion?
Sure. I think we know that the earlier we treat MS, the less disabling it is. And so if patients have access to these drugs and they can be started on drugs earlier, then that prevents future disability and allows them to be more productive members of society and cost the healthcare system less. And so this early investment in these medications really can have long-term benefits for both the healthcare system and communities and nations at large, and certainly has personal benefit for patients who get to continue to live healthy and productive lives.
Nick, turning to you for a second, in terms of raising awareness and advocacy, can you talk a bit about the ways in which MSIF raised awareness for this cause to garner support from the medical community, from policymakers, and of course the public?
Yes, in a way, we had to be quite subtle. There are times when advocacy is very loud, kind of in your face, but it wasn't appropriate for what we wanted to achieve here. And that's primarily because the WHO is rightly concerned that their decision-making process, their EML committee, should be insulated from outside influence. They really, really don't want people to lobby its members. They want it to be as independent as possible. And when we wanted them to take a positive decision for MS, of course, we just naturally wanted to go through their processes and do things the way they wanted us to do them. So we were very careful, really. We worked really closely with the WHO teams, the secretariat responsible for the EML, with the Brain and Health Unit. But we very carefully didn't try to lobby the committee itself. But what we also wanted to make clear to the committee was the extent to which the whole MS community was behind this application, that it wasn't just MSIF, it wasn't just one or two bits of the world. And so that's why we put a lot of effort into securing the endorsement of a really wide range of professional organisations, including ECTRIMS, but from all over the world. And of course, we had the broad range of patient organisations that are part of MSIF behind the application too. So it was really trying to convince the committee that the whole of the MS community was serious about this, that we were all behind it and we all wanted them to give a really positive verdict, rather than the kind of loud lobbying that sometimes works at national level.
And I know that ECTRIMS was very proud to be able to endorse this bid and to help promote awarenesses as much as it could. Moving forward, how do you think advocacy efforts can continue to ensure the effective implementation and the utilization of MS treatments within the EML framework?
Well, as Diana was saying, it's a long haul, really. Partly why, when people want us to be really celebratory about the verdict, which in a sense we are, it's kind of hard because we know how much work there is still to do all over the world to make a real difference on the ground for the treatment of MS. So there's so much work that needs to be done, particularly at national level. So MSIF will continue to work at its global level. It'll continue to work with regional authorities where they exist, such as in Europe. But in most of the world, it's national level effort that will really make a difference. And so we're already working to support organisations either where they already have advocacy capabilities, to start that process, to interact with their governments. Sometimes we take a back seat. Sometimes they want us to be much more part of that process. But also, as Diana mentioned, we are beginning the process of training organisations who have no experience of advocacy but who want to step up. They see the EML listing as an opportunity, and we want to help them to be able to be more influential within their countries. And I should say that a big part of that is, generally speaking, it's not just a patient organisation acting on its own. We're really keen to develop partnerships across the MS community. So in most settings, that'll be patient organisations working with professionals and their associations to bring influence to bear where it matters.
Moving over to the topic of quality and safety. With the inclusion of MS treatments in the EML, what measures are in place to ensure the quality, the safety, the efficacy of these treatments for patients worldwide? Deanna, is that something you want to take?
Sure. So the WHO does have standards that they suggest all drugs, especially generic formulations of drugs that are off patent, should meet. Again, though, this really is going to be national level advocacy from people with MS and healthcare professionals taking care of people with MS to ensure that the drugs that are procured and available at a local level meet these standards. And so I know MSIF is already working on supporting these efforts, but again, this is really going to have to be more of a local effort to ensure that regulatory authorities in countries are in place and monitoring the quality of the drugs that are brought in. As part of our guideline development process that laid the foundation for the EML application, we did, however, include guidelines as to how these drugs, assuming that they are high quality, how these drugs can be implemented safely and what monitoring should be required for each of these drugs in part of our guidelines. And so those will hopefully be published soon and can at least serve as guidance for clinicians who are maybe prescribing these drugs for the first time.
Okay. And in terms of regulating, Nick, can you talk a bit about how will MSIF collaborate with relevant authorities to monitor and regulate the availability and use of these medications?
Yes, I mean, some of our thinking is still evolving, in truth. We are already looking at ways in which we can improve availability of medicines, and we know that needs regulators to be on board. We're looking at the possibility of other organisations like the Medicines Patent Pool and the role they could play in helping to bring medicines forward at a more affordable level. But it's an area of work which we haven't fully fleshed out, in the sense that there's so many conversations we need to have to understand even what is possible and the willingness of various partners to now engage and take it forward, that we're still working on it, really. And as an example, throughout the application process of building that application, we had to keep industry at arm's length for the independence of the work. But we also know that industry is absolutely fundamental to the making available medicines all over the world. So going forward, we really want industry, regulators, other medicine organisations to come together to look at how we can make progress together in a partnership, because we know that will be the most effective. And we've sometimes pointed to an example in Egypt where they have already worked together in that way. Patient organisations, professionals, industry, government, And they have been able to find a path to make more medicines available at a level which is affordable in Egypt. It's an outstanding example. In a sense, we want to be able to replicate in other parts of the world, knowing that every country at a detail level is still different and the partners are all different.
Absolutely. On that note, in terms of future steps and sustainability, what are the next steps for MSIF following this achievement in terms of how will the organization continue to promote and sustain the impact of including MS treatments in the EML?
In a way, the secret is going to be determination and tenacity. We have to keep it up, really. So, as I've said, we've already got many conversations underway, but we know there are many more we need to have. We need to work more closely with this range of organisations that really matter. It's not going to be done and dusted within a year or two or even more. It's something we're going to have to persist with. But we have started, so there's already conversations taking place regionally in some parts of the world. We're now also talking already with governments in some cases. So the work is already underway. I wouldn't want to give the impression that it's all waiting for something to happen in the future. It has started. But it really is going to be a matter of persisting through a lot of work over a period of years.
Okay. And are there plans to expand the scope of this initiative to address other aspects of MS care and management?
Well, the MSIF strategy is to look at access to treatment, but also to look at diagnosis. And we know that, these things are, of course, are very closely linked, as I'm sure Deanna would say. But we do know that diagnosis is a part of the problem and that we need to diagnose people earlier in their course of disease. And in some cases, we simply need to diagnose people. So that's also a part of the challenge. And we've been focusing on access to treatment, but we do want to come back to the issue of diagnosis too.
Absolutely. Turning to patient voices, personal stories, would you like to share any stories or testimonials from individuals living with MS who are expected to benefit from this inclusion in the EML?
Well, I won't name names, but
okay.
I'll try to give a flavour of some of the stories that come our way. And some of them are before we secured this listing, but I will say that we've received an awful lot of messages of thanks, really, from all over the world, from people who expect things to now get better for them or for people that they know. And the kind of stories we have is that people, as I indicated earlier, they know that they need treatment, they want to be treated, but there isn't anything available for them in their country other than, in some cases, steroids. Also people that they may have been able to access treatment intermittently, but the intermittent nature of that is really not helpful. So what they're looking for is a more sustainable supply of therapy within their setting, within their country. We have so many examples of that. And there are people they see the kind of medicines that are provided in places like Western Europe or in the United States, and they really want to be able to benefit from scientific progress. They really would like to be able to move on to more effective therapy. So there are so many stories that we receive, but there's a common strain through them, really, that there is an appetite to improve the treatment of MS, obviously from the patient point of view, but also from the perspective of clinicians. Clinicians all over the world, as much as anyone else, will understand the scientific progress which has been achieved even over the last 10 or 15 years, and they'll want their patients to benefit from that too.
Absolutely. And I think hearing stories such as that and receiving messages of support such as that really just makes this milestone all the more important. And I know that this was a huge global collaboration as well. Deanna, I know the MSIF's bid, it did involve a collaboration with various stakeholders. Do you want to take a moment to shed some light on the partnerships and alliances that were formed to achieve this milestone?
Sure. It certainly was a global effort. I think, I mentioned on our committee that helped to develop the guidelines that laid the foundation for the EML application, we had clinicians, people with MS, and lots of different healthcare workers from all over the world. And it was a great opportunity just to meet and work with them and collaborate with them. We worked with the McMaster Guidelines Center in Canada. We worked with the WHO Collaborating Center in Italy. The WHO Brain Health Unit was incredibly collaborative with us. And so developing the application itself was a very globally collaborative process. And then getting the support of 14 endorsing organizations, including ECTRIMS, including ACTRIMS, including all of the regional TRIMS, MNACTRIMS, IMPACTRIMS, and LACTRIMS, and then national neurology organizations, the American Academy of Neurology, the African Academy of Neurology, and I can't remember all of them offhand, but and the Neurological Association of South Africa is another one that comes to mind. Just seeing the whole global community come together to either directly support the development of the application or endorse the application to really demonstrate to the WHO that this was a global initiative and a global collaboration was really exciting and humbling and motivating.
Absolutely. In terms of educational outreach, this is another subject that I want to talk about very briefly. Education, as we all know, it plays a crucial role in maximizing the impact of such initiatives. Nick, how does the MSIF plan to educate healthcare professionals, patients, and communities in general about the availability and importance of these treatments?
Yeah, it's a really important area. I mean, of course, MSIF is a small organisation with quite small resources, but this is where collaboration is important. MSIF already works, for example, with ECTRIMS and the other TRIMS around the world. And so through organisations like that, we hope that the community has quite a lot of reach, even if MSIF itself is small. Our partners together reach a lot of people, reach a lot of professionals, for example. The members of MSIF, patient organisations, reach a lot of patients. So it's by working with all of the various partners together that we hope to be able to reach people. MSIF itself has already started a process of stepping up education of MS organisations at national level. People are already signing up, for example, to webinars to learn a bit more about how they can advocate effectively. So that sort of thing we will certainly be doing. But there's absolutely no doubt that we need to make the partnerships we have work and work effectively.
Wrapping things up, and this is a question for both of you, what message would you like to send out to listeners who may want to support the MSIF's efforts or learn more about how they can contribute to improving MS treatment access worldwide? Nick, would you like to start?
Well, in a sense, I think one of the things which I've found most gratifying through all of this process is the extent of solidarity that has been expressed throughout the MS community, patients and professionals. And there was a Norwegian neurologist just the other day talking about how their access in Norway to medication is very good. But they felt that the EML listing by the WHO was really important for other countries and for other settings. But they wanted to celebrate that out of a sense of solidarity. And that, to me, is a huge achievement for all of us working together, that we take seriously what each of us wants to achieve, and we know that we'll have more influence by working together. And so that's what gives me hope in a way. The fact that this has been such a collaborative process gives me hope that for the work that needs to be done over the years ahead, there's an awful lot of great minds that are willing to address the problem.
Wonderfully said. Thank you, Nick. And Deanna, is there anything extra that you'd like to add as well?
Yeah, I hope we have inspired people to join us in this next long haul effort to really actuate this announcement and make sure that it results in practical improvement and access to people with MS across the globe. I would suggest if people are looking for practical first steps, people with MS, I think, can reach out to their national patient organizations and ask them what they're doing, and encourage them to reach out to MSIF and see how they can join in advocacy training or whatever it is that they're interested in. I think healthcare professionals, the same, reach out to your national organizations and encourage them to become involved. The MSIF website is an incredible resource. It has lots of information, lots of great toolkits and education kits and starter letters to reach out to your government representatives. And so I think just start by really engaging your national organizations to become engaged in this process, and then utilize the resources and the networks that MSIF has already created to learn what others are doing and benefit from their experience, and then start to take your own first steps towards this advocacy and access process.
Very well said, Deanna. Thank you, Deanna and Nick, and thanks everyone for listening. Once again, I'm Naomi Smith, host of this podcast episode. The ECTRIMS Podcast is produced and hosted in collaboration with two key partners, the MS Journal, a peer-reviewed international journal that focuses on MS and other related autoimmune diseases of the central nervous system, and MS Translate, an independent resource center that aims to simplify the complex wealth of information about MS for the greater MS community. The ECTRIMS Podcast is supported by an educational grant from Roche, Alexion, AstraZeneca Rare Diseases, and other grant providers. Educational grant providers have no input on the podcast series content. You can read more about the topic of this latest podcast episode and more on the ECTRIMS website, ectrims.eu. Do subscribe to the ECTRIMS Podcast on your favorite podcast channels and follow ECTRIMS on X, formerly Twitter, as well as LinkedIn, Facebook, and YouTube.